Oops. All right. How do I see if there are people on here? Let's see, we'll give it a few minutes. Hi everyone, it's Dr. Obzeda here at Pelvic Rehabilitation Medicine in Los Angeles. I'm just gonna give it a few minutes, let some more people join, and then we'll start going over comorbidities in endometriosis. All right, so about 1 or 2 more minutes. Hope everyone's having a good Wednesday. It's nice and sunny here in LA, so can't complain too much. Okay, so it looks like we have a good amount of people, so I'll go ahead and just get started. And if anyone has questions, go ahead and put them in the comments, or I honestly don't know how it works. It's my first live video, so we're gonna get through this together, all right? So comorbidities and endometriosis. So first off, what is a comorbidity? Basically, it is just a disease or a medical condition that is simultaneously present, right? So there could be a correlation, and I will go over some of those with endometriosis, but for the most part, a lot of them, we can theorize why it's happening with endo, but we're not 100% sure why. And obviously there's a lot of research going on still. So some of these are still just theories or just thoughts. So I will let you know of those, okay? So as we know, endometriosis causes a ton of inflammation, causes a lot of inflammation in the pelvis, but not just the pelvis. It's gonna start causing inflammation systemically. All those like inflammatory cytokines and inflammatory signals kind of going all over our bodies. So we can get a lot of different symptoms that are, endometriosis isn't the first thing that pops up in our head when we start having these symptoms. So I'll start with the pelvis and kind of move up the body. So with endometriosis, all that inflammation is going to cause, abnormal growths of tissue that we call adhesions, okay? Those adhesions can cause a distortion in the anatomy of the pelvis, cause, abnormal growths going from the uterus to the uterine wall, and those adhesions can not only lead to pelvic pain, but can also lead to distorted anatomy, which can start to affect fertility, right? So we all know that endometriosis and infertility kind of, that's a big part of endo, is it can cause infertility. Also with that inflammation and those endometrial lesions, since they can kind of be anywhere, honestly, in the body, in the pelvis, if they're in certain places, it's going to cause certain symptoms. So if it's on the bowel, right, we're going to have a lot of bowel symptoms that can kind of look like IBS symptoms, constipation, diarrhea, bloating, which we call endobelly, abdominal pain, nausea. So a lot of patients, that we see here will have abdominal symptoms, and they've seen, a handful of specialists, gastroenterologists, they've got the EGD, they got the colonoscopy, their GI system looks good, but it's that endo that's actually causing all those symptoms. If we have endometrial lesions on the bladder, on the ureters, we can start having urinary symptoms. So we see a lot of interstitial cystitis or painful bladder syndrome here in the clinic. A lot of those patients will also have endometriosis, but when those lesions are on the bladder or around the bladder, we can have urinary urgency frequency that feels like a UTI, right? So our patients will be in and out of urgent cares, getting urine tests, getting, one antibiotic after another, and it's not actually a UTI. It's those lesions causing a lot of irritation that's starting to lead to those urinary symptoms, okay? What else? So we got urinary symptoms, we got bowel symptoms, we got pelvic dysfunction, right? So adhesions, inflammation causes a lot of dysfunction in the pelvis. That's going to lead to pain. That can be pain, on the anterior portion, so around the abdomen, can also be in the hips and the low back. So pain pretty much anywhere below the umbilicus, so the belly button. With that systemic inflammation that endometriosis causes, It can lead to weird symptoms like joint pain that can be, thought to be something like fibromyalgia, or it can cause, a lot of fatigue. It can also lead to migraines. So one theory is that migraines, are responsive to estrogen. Since endometrial lesions are also responsive to estrogen, that kind of flux during our cycles can lead to premenstrual migraines, right? Which is pretty common in our patients with endometriosis. It can also lead to, different types of joint pain. So jaw pain, TMJ, we see pretty often. Just random, shoulder pain, hip girdle pain. So a lot of these things that we see with endo are typically diagnosed as something else. So our patients will always have, see several specialists and undergo a lot of, lab tests, imaging, diagnostic tests that can, they don't really get answers. And endo's kind of the last one on the list, or we don't even think, other physicians don't really think about it. Chest and rib pain, diaphragm and thoracic. Yeah, so like I mentioned, endo can be anywhere in the body. Rarely is it found in the lungs, but it can. That diaphragm pain and the thoracic pain typically is due to, involuntary guarding due to that pelvic pain. So with involuntary guarding, we're gonna have short breaths that can kind of lead to more muscular tension elsewhere in the body. So that's kind of when we get that thoracic, discomfort and pains in other parts of the body. But yes, endometriosis can be found in the lungs. Typically that's going to present as shortness of breath. There's also been some studies that show that endometriosis can lead to like allergies, allergic responses. It's thought to be due to like mast cell activation and histamine response, but that's still just a theory that hasn't been 100% proven. But it is something we can see in our endo patients is food sensitivities, skin conditions like eczema, asthma. A lot of weird stuff can happen, but everything in our body is connected. So when there's inflammation, especially with such big inflammation that endo causes, it can start to cause a lot of weird things that, it's hard to pinpoint exactly what it is. So yeah, that's kind of just a brief overview of comorbidities that can come with endo. Obviously, there are a handful of others that I'm not gonna get into just because it's a little bit more complicated and these are just still, again, theories. But I will say a big part of estrogen is thought to have a big part kind of in the pain pathway and can start to affect pain perception, right? So when we have endometrial lesions that are very responsive to estrogens, our pain kind of receptors in our central nervous system kind of get hypersensitized, right? So our pain threshold decreases. So that's why it's very important for us to also focus on desensitizing that central nervous system and not just focusing on the nerve in the periphery, so just in the pelvis. So we kind of have to calm both down and restore both of their functions so we can get long-term pain relief. Let's see, I know there are some people chatting in here. So yeah, we talked about problems with breathing. Yeah, that's that endo lesions, if they are in the pulmonary system, so in the lungs, can lead to like shortness of breath, asthma-like symptoms, but also endo lesions just kind of elsewhere in the pelvis can lead to mast cell activation, which causes histamine release that can cause also that shortness of breath and asthma-like symptoms. Right. Leg numbness. Possibly, if there's a lot of inflammation kind of in the lumbar sacral region that's causing impingement on a nerve, definitely, could be causing that. If, there's some genitofemoral ilioinguinal nerve involvement, it can cause kind of that inner thigh paresthesia or numbness that I have seen. Any other questions? Oh, also, and there's so much that, they just kind of pop into my head, but also uterine fibroids can be found in our endo patients, and that's because fibroids are also driven by estrogen. So a lot of times we'll see fibroids when we do imaging on our endo patients, which can obviously lead to more pelvic pain, heavy periods, infertility, all that stuff. Is pelvic floor PT covered by insurance plans? Sometimes, depends where you are. But yeah, I would just give your local pelvic floor PT a call and ask them, because everyone's a little bit different. You can also ask your primary care provider to refer you to someone that's in their network. That's also an option to get pelvic floor physical therapy covered. But any questions on comorbidities with endometriosis specifically? Let's see here. Yeah, comorbidities with endo, I will say, every patient's different. So, I listed quite a bit just because, if you do have endo or you suspect it, it doesn't mean you're going to have all these signs and symptoms. Do you feel that lupus is a comorbid? Yeah, so there is a thought that, endometriosis can cause increased risk of autoimmune diseases, but we really don't know the correlation. Autoimmune disease is your own body. There's so much inflammation and your body's kind of attacking itself, and endometriosis also causes a lot of inflammation. So, there's kind of overlap, but we haven't found one, specific kind of reason as to why we see more autoimmune conditions in patients with endo. But it is something we see more of in our patients, yeah. And not just lupus, other autoimmune diseases like thyroiditis, things like that. Could chronic low back pain or flank pain be caused by endo? Absolutely, yes. So that's a big one. The pelvis, I think of like a house, right? The pelvic floor is the floor, our abdominal muscles and our lumbar muscles are the walls, and our diaphragm is the roof. So if there's dysfunction in that floor, it's going to affect the rest of the house, right? So those lumbar muscles are usually affected because of the pelvic floor dysfunction. So we're going to have flank pain, we're going to have low back pain, we can have hip pain, we can have abdominal pain, and we can have those short, shallow breaths, right? That cause issues with the diaphragm in our breathing. Yes, if we had testicles, there would be much more funding to go, correct, yeah. But we're slowly getting there. There's more awareness in endometriosis, and that this pain is real, right? And patients are being validated in that pain, which I think is super important. I would say for those patients, struggling with pelvic pain and finding a diagnosis, be your, own advocate. If you don't feel comfortable at a certain clinic physician, go find a new one. It's all in your hands. So, listen to your body. You know what's going on with yourself. Find someone that's going to listen to you. Okay. All right. Any other questions or comments? All right, I'll give it a few more minutes, and then we're gonna get back to work, back to helping patients. All right, guys, well, thank you for joining. I hope you learned something today. If you have any questions, obviously shoot us a message. We'll be happy to answer them as best as we can. I know we have some more videos this month, some live videos going up, so stay tuned for those. So there's keeping in mind every patient is different. Is there an average of how many months or years are needed for rehab? So if we're talking about like pelvic floor, physical therapy, it all has to do with, the patient, how, the pelvic floor is doing, how their nerves are responding. But typically with our protocol, we'll usually have them in pelvic floor physical therapy for 12 weeks, and then we kind of reassess. Some patients will need a little more, some patients will be good and ready to graduate from that. But obviously the longer you live, you live with endometriosis, the more inflammation is happening, right? And the more issues that start arising. So unfortunately, it takes quite a while to diagnose endometriosis because it has all these weird symptoms that kind of look like different things. So by the time endometriosis is, diagnosed, it's been a handful of years. Some patients are lucky enough to get it diagnosed pretty quickly, others not so much. So, with rehabbing the pelvis and the nerves, there's no time frame. Every patient's different, but with our protocol, we usually will start with the 12 weeks of pelvic floor physical therapy, and then with what we do here in clinic, and then we kind of reassess. All right, guys, I am gonna get back to work here. I hope everyone's learned something. Like I mentioned, if you have questions, don't hesitate to shoot us a message. There'll be more videos throughout this month, and then stay tuned for some more videos from yours truly, Dr. O. All right, well, thanks for joining us, guys. Bye.